Welcome back. Now we are going to discuss extrinsic and intrinsic pathway. So let's start. In intrinsic pathway, the damage occur in blood or blood detect any collagen or glass material. Then it causes initiation of the intrinsic pathway. But in extrinsic pathway, the outer source damage the tissues and the blood vessel, and due to their damage, the extrinsic pathway start. So we start intrinsic pathway. Before we start, keep remember what factors are specifically involved in intrinsic pathway. Factor 12, 11, 9 and 8. So the damage to the blood tumor, collagen or glass activate factor 12 and it convert activating factor 12. A stand for activated. Then activated 12 factor convert 11 to activated 11 with the help of high molecular weight kininogen or maybe pre-kallikrein involved in their conversion. Then factor 11, activated factor 11 convert factor 9 into activated factor 9 with the help of calcium. And next, factor 9 form a complex with other things. What things are involved? Factor 9 and activated factor 8. This factor 8, actually factor 8 convert into activated factor 8 and become part of this complex, and tissue factor. So this complex involved in the conversion of the factor 10 to activated factor 10 in the presence of the calcium. Up till now, this is actually the part of the intrinsic pathway. Next is the extrinsic pathway. Extrinsic pathway means external source tissue tumor. Then it releases tissue factor or tissue thromboplastin. Tissue thromboplastin basically contain two components, phospholipids and lipoprotein. The lipoprotein components of the tissue factor make a complex with the activated factor 7. Actually, factor 7 convert into activated 7 with the help of the tissue factor. And this activated 7 become part of this complex. Lipoprotein come from this one, tissue factor, and activated 7 become part of this complex. And this complex convert factor 10 into activated factor 10 with the help of calcium. So this is a difference between intrinsic and extrinsic pathway. Next, common pathway which are same in both the extrinsic and intrinsic pathway. Actually now the main focus is on the prothrombin activator. We have to form prothrombin activator. What is prothrombin activator? Means it is a complex which activate prothrombin or which convert prothrombin to thrombin. So here factor 10 activate. This prothrombin activator contains activated factor 10, factor 5 and phospholipid. Phospholipids comes from two sources. First, it can be from tissue factor, phospholipid, or it may be come from platelets, phospholipids. So this complex activated factor 5, activated factor 10, 5 and phospholipid is called prothrombin activator. It converts prothrombin into thrombin with the help of calcium. And then thrombin convert fibrinogen to fibrin monomers. And these monomers, here you can see different monomers forms. And these monomers are highly attractive, and they attract themselves and form a fibrin fibers. And there are several fibers which are parallel to each other form. Now, for the strengthening of the clot, they cross-link just like that, making angle 90. Make angle 90 degree. And here is a factor, fibrin stabilizing factor, which is actually factor 13. Stable the fibrin fibers. So this is the common pathway. Same occur here. Factor 10 convert into activated factor 10. It form a prothrombin activator, actually factor 10, 5 and phospholipid. Like same exact this one. And with the help of calcium, it convert prothrombin to thrombin just like that. And prothrombin, here you can see thrombin convert fibrinogen into fibrin monomer. Fibrin monomer. Then fibrin monomer are highly attractive and form a fibrin fibers, and they are again in parallel fashion, and they form, after that they form cross-linked fibrin fibers, making angle 90. And again factor 13, which is fibrin stabilizing factor, involved in cross-linking. So this is the basic difference and similarities between the intrinsic and extrinsic pathway. So hope so you got the point. If you have any question, then you may ask in the comment section.